very surprising symptoms that I found of the perimenopausal menopausal journey had everything to do with my mouth. Yes, we hear about hot flushes and we hear about weight gain, we hear about I can't sleep, but what we don't hear very often are things like dry mouth or periodontal disease or burning tongue. And that's what we're going to go into today because I've been able to talk to several integrative dentists and a new 2024 article that came out talking all about menopausal oral health and all the changes that can happen. Now, remember, your mouth is the gateway to the rest of your body. So if you're having digestive issues, if you're experiencing inflammation, you're definitely going to want to pay attention because the start of it all could be your mouth. Hi, I'm Dr. Carrie Jones. I'm a women's health and hormone expert. You're going to want to hit that subscribe button because I know hormones can feel like herding cats, and I'm here to help. All right, let's start at the top and go for the mouth. Here's some research that I found. 50% of women experience dry mouth, and it's because the decline in estrogen in particular decreases the salivary flow. Now, if you don't have a lot of salivary flow, that's going to impact your gums, your teeth, and your microbiome that's up there in your mouth. And remember, every time you swallow, it goes all the way down your stomach and then down into your small intestines. So it's completely possible any inflammation or infection you have going on in your mouth, even subclinical, like a little bit, every time you swallow that inflammatory bacteria down into your stomach, into your intestines. So if you're having GI symptoms, stomach issues, definitely make sure you're talking to a dentist who understands that you're over the age of 40 and what you're going through. More statistics. I found up to 60% of women have an increase in gum disease. Now, some gum disease and inflammation is reversible. There's a lot we can do. And some, my dental friends tell me, is irreversible once it's moved far along. So let's catch gum disease. Burning tongue, up to 40% of women, depending on what research you read, experience burning mouth or burning tongue. And it's exactly what you think it is. It sounds absolutely awful. And every woman who I know have experienced it has said it's absolutely awful. And again, the change in estrogen coupled with the change in the saliva flow, change in hormones and vitamins and minerals and all these things, the change in life definitely impacts what's going on in the nerve receptors around the tongue and in the mouth. There's an increased risk for cavities and for some women, an altered taste, metallic being the most common. Now, I've discussed before other kind of weird symptoms like itchy ears and phantom smells, but what we haven't talked about is oral health. And yes, a metallic taste sort of out of nowhere can be one of the symptoms. Now, as I said, hormone changes is a big reason. In fact, the decline in estrogen, estradiol, is like over and over discussed in research is the big gun. But we know progesterone also plays a role in the mouth because we know when women have really high levels of progesterone, such as in pregnancy, but they also have high levels of estrogens, that their mouth changes as well. So we do have to look at both hormones. Now, in the Journal of Midlife Health in 2024, a really great article came out titled Menopause and Oral Health, Clinical Implications and Preventive Guidelines. And as I said, I also had the absolute pleasure to talk to several integrative dentists who fully understand what women go through, what's happening to their hormones, and how that shows up here in the oral cavity. I didn't even mention on the outside, TMJ is super common. I talked about all the inside stuff. Outside TMJ is super common, and we're going to talk about what can be supportive of that as well. Now, you may be thinking, well, I've been stressed, I've been grinding. Absolutely, that for sure can play a role if all this is really tight. But the change in hormones, specifically, I read both estrogen and progesterone, but some of my dental friends are like, progesterone plays a real big role here at the TMJ joint. And you may find if you still cycle, that if you're not making really good levels of progesterone, that outside TMJ pain gets a lot worse. Now let's talk about what you can do, because thank goodness with oral health, mouth cavity, we have an entire profession called dentistry that can be helpful, but there's also a lot you can do at home. Now, when you're looking for a dentist, definitely look for a dentist who's maybe bent is more integrative or holistic and fully understands that you're over the age of 40 or over the age of 50, your hormones are changing, and as a result, you have to be a lot more diligent with what's going on the outside and the inside of your mouth. I mean, let's try to avoid the dry mouth. Let's try to avoid burning tongue, and let's try to avoid as many cavities as possible. So obviously regular dental cleanings are where it's at. Now, historically, we all were taught every 6 months for a dental cleaning. My dentist friends tell me that sometimes for some women, they're having them come in every 2 to 3 months initially until they get things going because the changes in perimenopause heading into postmenopause can be so rapid that it really can affect the teeth, the gums, the microbiome, the tongue, etc. So if your dentist says to you, hey, I know we used to go every 6 months, now we're going every 3 months, it's for good reason. And remember, every time you swallow, it goes down to your stomach and then in your intestines. So we want good mouth health for the rest of the body. We also want to focus on flossing. When you get up in the morning, you want to floss and brush your teeth before you eat anything, before you have your coffee. You don't want to wait and do it later, according to my dental friends. You want to do that first thing. And if you can, try tongue scraping with the tongue scraper. Now, a tongue scraper, you literally just hold each side of it on the tongue and pull down. Be gentle, don't rip your tongue, but be very careful also if you do have dry mouth. If you have dry mouth or you're noticing that as you scrape, I don't want to cause any kind of micro tears or bleeds in your tongue. But if it feels pretty good and you're scraping off some junk, then make sure you do tongue scraping every morning. So do your flossing, tongue scraping, and then brush your teeth. Now, I've also had some dental friends talk about with that dry mouth to rinse with a teaspoon of baking soda in some water. So get some water, preferably filtered water of some sort, not carbonated. We'll talk about that in a second. Mix a teaspoon of water in there and swish and spit, swish and spit, swish and spit. And that baking soda has been shown to help make it like less acidic in the mouth. Now that brings me to carbonated beverages. Carbonated beverages such as carbonated water, if you like sparkling water, but even if you like soda or anything that's carbonated, that's more on the acidic side and it could be causing problems right now with your teeth. So according to my dental friends, you may want to cut back on that. Watch those carbonated beverages. And when you're rinsing, use just regular water. Filtered is best. Teaspoon of baking soda mixed in it. Swish and spit that out to help with supporting the dry mouth and again, then the microbiome and lowering inflammation. Now, what about some minerals? Your teeth are like little organs, little glands. I mean, they require minerals. So are you getting proper minerals? Are you adding in extra vitamin D or do you need vitamin D? Have you been tested for vitamin D? Now, vitamin D you shouldn't take by itself. It needs other minerals to play. In particular, it needs magnesium and vitamin K2. So you will often see vitamin D mixed with these other cofactors to help it work better. And in fact, my particular most favorite vitamin D is by New Ethics. It's called New D plus K2, and I have a link for that if you are interested. But you can always find vitamin D with K2 and magnesium in other places. You can also ask your healthcare practitioner and sometimes even your dentist to get a vitamin D test and see what your vitamin D is up to. Remember, it plays a big role in teeth health. We're trying to optimize that. Now for burning tongue, again, a lot of it plays with oral health, your hormones, but also my dental friends tell me that they've seen B vitamins play a positive role in burning tongue. So it's possible you are deficient in B vitamins and need extra B vitamins as you're making this perimenopausal, menopausal transition, and that may also help support the nerves. In particular, I often see B6. You want the active form, which is called P5P. Make sure the label says P5P and or B12. So something like a methylcobalamin, hydroxycobalamin, adenosylcobalamin. And in fact, I have an entire video all about vitamin B12. So if you're new to the concept of B12, be sure to watch that because that can also change and be problematic as you move through perimenopause. Now, let's get to HRT because that's the big one. If you are considering HRT, do know research has shown that yes, taking estrogens, taking progesterone has been shown to be supportive. Now, the research is very limited and kind of scarce. We have a little bit, and I have a lot of input from my dental friends, my dentist friends, of course, who say they can tell a woman who's on hormone replacement therapy as opposed to somebody who's not. If you can't go on hormone replacement therapy or you choose not to, I just gave a whole list of other support, plus your dentist may give you a whole list of other support. This is just a place to get started. This is not an all-encompassing list of support to really help. But if you are on HRT, you may notice that your Your teeth, your gums, your microbiome, your tongue, everything may improve, especially if you had dry mouth or you had burning tongue and went on HRT. Another thing I noticed, this is purely anecdotal, I don't have any research behind this, is that if you are using or have topical progesterone, I have seen women take topical progesterone, like a little bit or a little bit of progesterone oil, or just a little pump of progesterone. They rub it into their TMJ area, and I've seen their TMJ symptoms improve. And especially in a woman who still cycles. So if you still cycle, but maybe you're not making very good levels of progesterone, so you get your period, but you're like, oh, in the week leading up to my period, my TMJ is bad, or in the days leading up to my period, my jaw really hurts, my TMJ is bad. Again, anecdotally, I've had women say to me, I just rub a little progesterone oil or cream right here at the TMJ joint, which is right in front of your ear. And that can make a lot of difference for them. And especially if you grind or clench at night, if you're very stressed out, make sure you rub a little bit in before bed. Be careful though, you don't want to transfer that to other people. So don't rub it in to on your, on the TMJ joint area and then, have a big makeout session or have somebody snuggle right up next to your face. You don't want to transfer that progesterone cream or oil to somebody else. You want to make sure that you rub it in really well, wash your hands, and if you do it at night and when you go to bed, that you're not face to face with somebody. So it might take a little the spontaneity out. It might take some cuddling stuff out. But anecdotally, if you are experiencing TMJ, it might make a world of difference. So I hope that helps. I hope you understand the critical importance of oral care, mouth care as you're making this perimenopausal transition. Because when I read these statistics, 50% dry mouth, up to 60% gum disease, up to 40% burning tongue. Why is this not being shouted from the rooftops? Why are dentists not going over this? Why is this not making the news? It should be, and I want you to be informed. So I really appreciate you listening. I hope you recognize that a lot of that list you can do by yourself at home. Make an appointment with your dentist if you haven't in a long time. And if you need a new dentist, be on the lookout for a dentist who maybe leans more the integrative holistic and understands the woman who's going through the perimenopausal menopausal transition, because you're going to need a little more support than maybe somebody who's younger. Again, my name is Dr. Carrie Jones. Hit that subscribe button. We also love to read comments. We understand hormones can feel like herding cats, and I am here to help.